I'm Ryan Miller,
I'm Bray Kelly.
I'm Molly McIntyre.
and this is our video evaluation for the hand, wrist, and thumb for AIM-2.
We would be doing all of the tests bilaterally, but for the sake of time, we'll be doing it unilaterally.
And I give consent for the whole video for them to test on my hand.
I also give consent.
I also give consent. Okay, we're going to be starting with special testing. So the first special test is the phalanx test, which tests for carpal tunnel syndrome. So you're going to have your patient have their arms out in front of them, bent at 90 degrees, and then you want to have them flex their wrists, and then you just want to have them apply pressure to both of their wrists at the same time, and they're going to hold in that position for 30 seconds or a minute. A positive sign would be numbness and tingling in the first, second, and third finger, and that's due to the compression of the median nerve. So the next test we're going to be doing is the Allen's test, which tests for capillary refill in the hand. So what you're going to do is apply pressure on both sides of the wrist right here. Then you're going to have your patient rapidly open and close their hand until their hand gets pale. So what we're going to do, we're going to have patient do that, and then go ahead. You can see the hand gets pale, and then we're going to take the pressure off from one side. So open your hand up. And then we want to see capillary refill, and then this side. Okay, so that's good. So a positive test would be if there's a delay in the capillary refill.
So now we'll be doing the Finkelstein test, which tests for de Quervain syndrome. So I'll have my patient grab her thumb in a fist, and then she's going to push her fingers down to the ground. And then a positive for the Finkelstein test is pain elicited on the radial border of the snuff box, and it would be positive for de Quervain syndrome. So next we'll be doing the Tinelstein test, and this test can be a positive for carpal tunnel. So what I'm going to do is I'm going to find the palmaris longus, and then I'm going to tap on the median nerve. And a positive for this would be numbness and tingling in the first, second, and third digits.
The next test we'll be doing is the Watson's test, and this tests for a scapholunate ligament tear. And for this, I'm going to hold my thumb on the scaphoid. I'm going to hold it in place. I'm going to have Ryan ulnar deviate or put his fingers towards the table. And then as we come back into radial deviation, I'm going to release. And if there is a pain or clunking of the scaphoid for the patient, that's a positive.
So next we'll be muscle testing the flexor carpi radialis. So the origin is the medial epicondyle of the humerus, and then the insertion is the base of the second and third metacarpals. So the action for the flexor carpi radialis, it flexes the hand at the wrist and it abducts the hand, and then the nerve is the median nerve. Now we'll be doing muscle testing. So I have my patient in a position with his limb against gravity and a muscle lengthening position. So first we will be doing active motion against gravity. So I'm just gonna have him move his wrist up and down. Perfect. And now I'm going to be doing active resistance. So he's going to do the same motion, but I'm going to apply resistance. Okay. And then we will be doing the brake test. So I'm going to put him halfway position, and then we're going to do a 5-second brake test. So he's going to resist my tension. Okay.
Next, we're going to be testing the range of motion for wrist extension. So what you're going to do with your goniometer is align the axis with the head of the ulna. The stable lever arm is going to be aligned with the ulna, and the movable lever arm is going to be aligned with the fifth metacarpal. So we're going to go just like this, like that. And then you're going to have your patient bring their hand to the ceiling as far up as they can go. So go ahead and do that. Right there, we're about 55 degrees, and then I'm going to apply a little bit of pressure. We get them to 74 degrees. So normal measurement would be between 75 and 85 degrees. So she's just a little bit under that mark, but that's about normal.
Next, we will be doing the ligamentous testing of the collaterals of the phalanges and thumb. I'm going to start with the proximal first. Did you feel any pain?
No.
So I experienced there was an end point and there was no pain, so that there was no sprain in the proximal joints, collateral ligaments, and now I will be going on to distal. Did you feel any pain?
No.
There was no pain and there was an end point, so there was no sprain in those joints as well.
So we have our patient here. She is a 50-year-old female who is a cashier working at Tops, and she has been working there for the past 30 years. So it's been a really long time. So what happened? What's causing you some issues?
So I'm not really sure what happened, but there's a lot of numbness and tingling in my thumb, index, and middle fingers.
Another question. Okay, and do you also have any pain in your thumb, index finger, and middle finger?
Yeah, so it keeps me up at night, especially when I'm trying to sleep, and I am a side sleeper. I don't know if that has to do with it, but yeah, it causes me a lot of radiating pain down my fingers.
Okay, and do you ever hear any noises
No.
coming from your fingers?
No, never any noises.
Okay, and do you have any previous injuries?
Yeah, I had a knee replacement done 2 years ago.
Okay, and what about any medical problems?
Yeah, I have weather-induced asthma.
Okay. So we have done the Phalen's test and Tinel sign test, and those were both positive. And the fact that she is experiencing numbness and tingling in her first, second, and third digits, and she has been a cashier at the grocery store for so many years, those are all pointing to carpal tunnel syndrome.